If you are over the age of 60, the rules of heart health have fundamentally changed. The advice that worked for you in your 30s and 40s is no longer enough to protect the most vital muscle in your body. We often think of heart disease as a plumbing problem, a pipe simply getting clogged over time. But modern cardiovascular medicine tells us a completely different story. It's not just about the clogs, it's about the walls of the pipes themselves. Welcome back to Health and Well-Being. And today, we are doing a deep dive into the number one health concern for older adults, cardiovascular disease. Over the next 25 minutes, I'm going to give you a clinical masterclass on what is actually happening inside your arteries right now, why standard blood pressure readings might be misleading you, and exact evidence-based protocols you can use to protect your heart. Let's get to the root of the problem. Endothelial dysfunction, the root of arterial aging. To understand your heart right now, we have to talk about the endothelium. This is a microscopic, one-cell-thick lining inside all of your blood vessels. When we are young, the endothelium is a slippery, flexible Teflon coating. It produces a miracle molecule called nitric oxide, which tells your blood vessels to relax and expand. But as we pass our 60th birthday, endothelial function naturally declines. Our body's ability to produce nitric oxide drops drastically. The vessels become stiffer. That Teflon coating turns into Velcro. This is called endothelial dysfunction, and it is the very first domino to fall in cardiovascular disease. It is what allows cholesterol to penetrate the artery wall in the first place. You can have perfect cholesterol levels, but if your endothelium is damaged, you are still a high risk. The post-pressure paradigm and the blood pressure trap. This brings us to one of the most dangerous traps I see in the clinic. Misunderstanding blood pressure in your senior years. You are probably used to looking at two numbers, say 120/80. The top number is your systolic pressure. The bottom is diastolic. But there's a third, hidden metric that becomes critically important as our arteries stiffen. This is your pulse pressure. It is the difference between the top number and the bottom number. Because of that arterial stiffening we just talked about, it is incredibly common for older adults to develop what we call isolated systolic hypertension. The top number creeps up to 140 or 150, but the bottom number drops to 70 or 60. If your systolic is 150 and your diastolic is 60, your pulse pressure is 90. A healthy pulse pressure is generally around 40. A widened pulse pressure is a massive red flag. It acts like a physiological hammer, pounding against the delicate microvessels in your brain and your kidneys with every single heartbeat. If your top number is high but your bottom number is dropping, do not let anyone tell you your average blood pressure is fine. It requires specific clinical management. Plaque vulnerability versus plaque size. Now, let's talk about the plaques themselves. If I asked you which artery is more dangerous, the one that is 70% blocked or the one that is 30% blocked, you would probably say the 70% one. But that is the great myth of cardiology. Most catastrophic heart attacks do not happen from massive, stable, calcified plaques that have been there for decades. They happen from small, vulnerable, highly inflamed plaques that suddenly rupture. When they rupture, the body forms a clot instantly, taking an artery from 30% blocked to 100% blocked in a matter of seconds. This is driven by systemic inflammation. This is why we don't just look at an LDL cholesterol panel anymore. We look at inflammatory markers like hsCRP, high-sensitivity C-reactive protein. We want to know not just how much cholesterol is in the blood, but how angry your immune system is about it. The reversal protocol, evidence-based action. So, how do we fix this? How do we lower the inflammation, boost the nitric oxide, and bring that pulse pressure down? Here is a clinical protocol you can start today. Number 1, dietary nitrates. To rescue your endothelial function, you need raw materials to make nitric oxide. This comes from dietary nitrates found in dark leafy greens, specifically arugula, spinach, and beets. A daily intake of these specific vegetables has been shown in clinical trials to significantly lower systolic blood pressure in older adults. Number 2, Zone 2 cardiovascular training. You don't need to run marathons. In fact, extreme high-intensity exercise can sometimes be counterproductive if you have existing arterial disease. You need Zone 2 cardio. This is movement at a pace where you are breathing heavily, but can still hold a conversation. 45 minutes, 4 times a week. This specific intensity builds new microscopic blood vessels, a process called angiogenesis, acting as a natural bypass for your heart. Number 3, omega-3 index optimization. It is not enough to just take a random fish oil pill. We need to actively reduce systemic inflammation to stabilize those vulnerable plaques. Clinical trials show that high doses of EPA and DHA, the active components of omega-3s, can reduce cardiovascular events. Talk to your doctor about testing your omega-3 index. We want that number above 8%. Conclusion and outro. Aging is inevitable, but arterial decay is not. By understanding your pulse pressure, focusing on endothelial health, and lowering your systemic inflammation, you can fundamentally alter the trajectory of your cardiovascular health. If you found this masterclass helpful, please like the video, subscribe to Health and Wellbeing, and share this with someone you love. I have linked all the peer-reviewed clinical trials we discussed today in the description below, so you can read the science for yourself. Until next time, stay informed and stay healthy.